to our mid-year all-site virtual CoIIN meeting. Today, we wanted to start with some welcome. So these are some of our team pictures from our time together in Atlanta. And we're sorry we can't see all of your beautiful faces, but we thought we'd put them on the screen so you all can maybe remember what each other look like. Just a few notes, as we mentioned, as you're joining us, please, if you have your computer speakers on, please go ahead and make sure to mute those so that we don't get an echo. And it's great if you mute your phones, but we also this is the time for us to chat. So if you go on mute, don't stay on mute forever. We wanted to let you know that we are recording this, but we're only recording it for our internal purposes. So we're not going to be posting this on the website or anything like that, but we just wanted to be able to have a nice record of some of the conversations for our team. So we just wanted to call your attention to that. So for our time together today, we're going to talk super briefly about kind of what we've done so far and where we are. And then the heart of our time together is really a chance for us to share about our different projects. And we'll start by offering our state team leads an opportunity to give a quick overview, high-level view of what's going on in their state. And then we'll have a chance to have some open conversation around some of the successes, some of the future activities, some of our collaboration, and then for us to get an understanding of what kind of technical systems would be helpful for you over the next 6 months. I wanted to take a pause and offer a special thank you to Joyce and Jill and Joellen and Leah and CoIIN and Maura and Diana who've been serving as our state team leads, and so they get the prize of talking to Erin, Suzanne, Catherine, and I more than the rest of you, and we just wanted to recognize their time and contribution and the leadership that they're providing and really thank them for that. So just as a reminder for all of us, and for those who haven't seen it, this is a picture from our Atlanta meeting. Our goal for our work together is to develop, implement, and disseminate a woman-centered, clinician-engaged, community-involved approach to the Well Woman Visit to improve the health status of women of reproductive age with a particular focus on low-income women and women of color. And I continue to feel really excited and grounded by our woman-centered, clinician-engaged, and community-involved approach. It is feeling to me from hearing the different work that you all are doing that is a really important kind of three-pronged approach that we're taking, and I'm excited that seems to be resonating well across the different projects. And just a quick summary, just to remind who we all are. So we have 14 project sites, which is amazing, from California, Delaware, Oklahoma, and North Carolina. And we estimate that all of you combined have larger than 100,000 women of reproductive age reach. So that's a really significant potential impact for our project. Y'all collectively represent 2 health departments, 3 academic/residency programs, 4 federally qualified health centers, and 5 Healthy Starts and care management programs. So again, we also, all of you bring really different and unique perspectives to the work. And I wanted to call your attention to something. If you look to the top right of your screen, you will see a document that says PCC CoIIN Pilot Site Summary. And so you may remember we bothered you for profiles about your different sites. And so we've put those together. So if you want to upload that and have that file for yourselves for later, that is a nice reference. So if you want to go and kind of put names and states with type of site, you can do that and kind of get a feel for what the different projects are doing. We didn't want to spend time getting to that level of detail during our time together, but I wanted to make sure that you saw that that was available. And so we are playing with polls today. And again, since we can't be together to do any good icebreakers, our first poll that you'll see on the screen is asking, what is your ideal summer escape? And I feel that we certainly have a trend towards ocean or lake for the beach. And a few international travelers, if anyone else wants to weigh in, mountains. I'm wondering if that's coming from Mayheck. Maybe people that live in the mountains like to go to the beach. Anyway, and obviously the poll is working, so thanks everyone for participating. So again, grounding ourselves in our bigger project, we all together understand and recognize that that getting someone seen for a well woman visit is a process that includes her knowing who to call, feeling why she might call, ability to schedule an appointment, which as a mom of 2 kids that work different part-time jobs that don't give you a schedule except every week in advance can be really tricky. Keeping an appointment, feeling prepared for an appointment, and I think our work is some of our Healthy Start sites I feel are starting to do some of this kind of schedule, keep, and be prepared for the appointment kind of work with our CoIIN. Our big focus is on screening around risks and needs and opportunities with the purpose of helping her get everything she can out of that healthcare encounter. And then we really want to make sure that she's receiving services that she needs if we've identified something or she's identified something that she would like support for. But then we also recognize that there's components of her ability to access that follow-up care, her support that she would need from the community and the people around her and providers to be able to act on whatever it is she wants to focus on for her own well-being, that people need to get paid for the services that they're providing, and that also from the bigger health system perspective that it's important that how we hold others accountable for referral care. So you could be provide the most wonderful encounter for someone and guide her well, and if you give a warm referral to a location that doesn't provide great woman-centered services, that's also part of the system. But again, for our piece of the work, most of us are focusing on this key screening and then making sure she's getting needed services. And as a reminder, our preconception CoIIN-wide measure is defined as the proportion of non-pregnant reproductive age women who are asked about their pregnancy intentions. And given all of the different perspectives that you all bring to the table, I think as a reminder, we centered around this one. In part, I think we're convinced by Dan Frame. He really identified that the answer to this question can be very pivotal in how a well visit proceeds. And so just wanted to remind you, I know you all know this, but that this is our CoIIN-wide measure that we're focusing on. And I just want to say I'm excited to see so many people joining. This is wonderful. So some of the work that you all have undertaken is you leaned into our human-centered design approach. Some jumped in fast, others kind of came along, and what we found across groups that have used this approach have found it to be very helpful and inspiring and kind of getting some different ideas and approaches to their work. And so these are just some of the pictures of, we've done some of this together as a big group. We've also know that you've done this in your different project sites, and I think we have some exciting work coming up in California in the future, and just wanted to lift up that that's something that's definitely innovative as part of our CoIIN project, and maybe some of you will talk about that later. I also wanted to lift up, I think that we've had some really out-of-the-park webinars so far in 2019. And we put them up because, A, they're still available for people to listen to. And while slides are always nice to see, I think all of our speakers were very eloquent. So if you were wanted to listen to it while you were driving, I think you would get a lot out of even just listening to it without having to sit there and look at the slides. So just wanted to lift those up to you. Dr. Sonia Barrero did a really beautiful job at really helping unpack the complexities of the word intended, and offered some strategies for different sites and clinics and people that connect with women of reproductive age in terms of thinking about how they might approach asking questions around whether someone wanted to become pregnant in the next year. So I would really lift that up to you as a really excellent resource, and I think it was only about 45 minutes. And then we had Jackie Murphy, and I think she is on today, did a great job at really, and I think had real talk about how we can incorporate screening in a clinic environment in a way that is authentic and relational. And also, Jackie has experience to have a Healthy Start site, so she also had some tips for doing that much more complicated Healthy Start preconception screening tool. And so again, Jackie's presentation is also recorded and also great to listen to. And then finally, we recently had Ken Harris, who you will recognize. He was at our Atlanta meeting, who really helped us think about this kind of the third part of our three-pronged approach, which is what does community engagement look like? And I thought that he had a really great approach to this particular topic. And part of it, he talked about how do we make a clinic feel more like a home or a place that feels safe and comfortable for our clients. And he talked about, well, how does the community feel and perceive our clinic? And what do we understand about the history of the community in which our clinic is situated? So I think he has some really great strategies and some also practical approaches. And so wanted to lift those up, but also kind of underscore how those are also aligning. So woman-centered for the first one. The second one is really this clinician engaged, and then the third one is community involved. Thinking about our Atlanta meeting, just wanted to also remind you that we have some more great resources on our website. Dr. Joya Creer-Perry, I thought, did a fantastic presentation with us to think about our own biases and how those affect our practice. And I know that the human-centered design work has lifted this up for many sites, and I know that you all are thinking about that. It may be something that we might want to invite her to do a webinar for us with that same presentation so that more people could hear what she had to say. Kay Johnson offered us some new policy strategies for advancing women's health, and I don't know about you, but I had never thought about earned income tax credit, and now I'm all interested in learning about earned income tax credit. So I think she had some great strategies. Dr. Dan Frayne offered a series of very helpful case studies, and I think we'll hear today, but some of the sites I know have actually used his slides and also found that that case study approach was really valuable. And then we had updates from our partners, including the Centers for Disease Control and Prevention, and also we had a greeting from the folks at HRSA MCHB. So that's where we've been, and now I think we have another poll coming. Drum roll, maybe. There we go. So our second poll is, other people are already responding, what topic are you most excited to share and learn about today? And we've had 3 people respond. So the strategies that have worked well, top resources that people use, how people are using data to support success, how people are continuing to get feedback, and others. Please chat. Very nice participation. Awesome. Well, I think we'll cover many of these, but it definitely looks like we have a strong interest in strategies, data, and also how we're going to continue to get feedback as we go forward. Awesome. So, to continue to make people happy, I am about ready to stop talking and turn it over to you all. And so again, we only want you to mute if you're not talking, but the mute is not meant to actually mute all of the things that you want to share. And so we thought that we would like to focus the first part of our time together on thinking about success. And so these are just a series of prompts to get people, wait, first we were going to do check-ins from the state. Sorry, let me get my head together. So let me take a pause and see what our states have to say. I'm going to start with Oklahoma because Joyce and Jill sent in a slide. This is their success, but I thought we could use this slide if either one of you wanted to kind of lift up just a real quick top level, kind of where is Oklahoma at?
Hi, Sarah. This is Jill. So just as a quick recap, our goal is to create a client-centered engagement tool that will open the conversation on preconception health and in the various different settings that we have engaged in the project. And so we have 7 pilot sites, and they include a family planning clinic, qualified health center, and our Healthy Start project. And the human-centered design process, as you mentioned, is challenging and rewarding. And working through this has been frustrating at times, but after our face-to-face meeting, we feel like it's a big success that we have figured out how to use the same tool in all 7 of our sites. Each site will use it a little bit differently depending on their clients and the services that are offered, but instead of ending up with individual tools for the different types of pilot sites, we've realized that we can create one tool that everyone can use just a little bit differently. So we feel like that is a big success.
Thank you. Great. Do we want to hear from North Carolina with just any kind of big picture of kind of where you are, big success overall that you've seen so far?
Sure. This is CoIIN. We have 3 projects in North Carolina. We're kind of all at, each project is kind of like at a different stage, if you will. Forsyth County is one of our counties that has struggled to kind of reach out to the agencies that they wanted to work with, but they've now gone over that hurdle and kind of drawn the people in that they need to work with, which is awesome. So they're just at the point where they're now using human-centered design to facilitate a co-design group to actually develop the tool that they plan to use. So they're kind of behind some of the other projects, but they had some initial hurdles to overcome, which they've done. Robeson County is already implementing their screening tool, and what they've done is they've embedded a dummy code into the electronic medical record. And they had hoped to start with just 1 provider, but they actually have 2. And so they're just now kind of looking at results to see how that's working. And then MAHEC, and I see that MAHEC folks are on the phone, so they can certainly talk more to their project. But they're kind of ahead of the group in that they started before the rest of us, their tool was implemented, and they're kind of at the assessment stage.
Great, thank you. Let's see, Delaware, do you want to give just a brief overview of where y'all are?
Great, this is Leah from Delaware at Public Health. We are working with 2 of our pilot sites. One is, or both actually, are a part of our Healthy Women, Healthy Babies program, and we're transforming that program to the next and taking it to the next level. One of the benchmarks that we are aligning with this CoIIN work is to ensure that the sites are asking the pregnancy intention screening question, whether it's at a primary care setting or another setting. So it's been very helpful to get those sites to that place. One of them, I think an amazing moment for us was one of the sites was, just to be transparent, they were scheduling women's wellness visits only if the woman was scheduled to have a pap smear. So they're really kind of taking a very different look at that prevention wellness visit, making sure that those women are scheduled, asking the pregnancy intention screening question. They just started doing a test, small test of change recently. The other site we've been struggling a little bit with in moving forward on this timeline, but I have no doubt that we'll be advancing this work. The other site is actually Christiana, and they are at the point where they're really making changes in their EMR. They're actually transitioning to a whole different EMR, and they have the pregnancy intention screening question incorporated into those changes. So from a long-term sustainability perspective, that's going to be an amazing opportunity, especially as we move forward with working with them. They'll be starting their small test of change very soon. We're still, trying to get some baseline data. We have something that's come through, but just with Oklahoma, I think with Oklahoma, it could be frustrating at times, but on the clinical side, I'm sure from our perspective too, just from timeline perspective, but in our minds, it's going to be an amazing opportunity to sustain this effort because, practice change takes a while. So that's where we are right now.
Thank you. That's great. And California, anyone want to give a quick overview of where California is? From California. Is Marta on? I see you. You might be muted. Catherine, did you want to give a quick until we hear from Marta?
I'm happy to, and Marta, please interrupt me if you would like, and whenever you get off of mute. So California, just to kind of go at that higher, broader level view, big success. There were some, in case as you all may recall, some challenges recruiting clinic sites at the very beginning of this project, and they have done a wonderful job of really getting some people who are very invested now. Both the Sutter and the Unicare sites are really working hard to work on this intervention, and we know that Sutter is already working on integrating this into their flow and testing their changes, and Unicare has also done some small tests of change. And looking forward, there is a meeting coming up with the whole California team, which is really exciting here in a couple of weeks. So there's a lot of great stuff bubbling in California.
Thank you. Thanks, everyone, for those nice overviews. So now we're going to open it up to the larger group. And actually, Christiana sent in a few slides. So if you don't have to, but if you want to, and if you're on, say a word about this is a success that you all noted that you had. Is anyone on? Emily or Karen? I don't see if they're on. We can all see the slide. You can read it. Kind of as Leah was mentioning, that they've definitely been making progress, and so they lifted up a success that they'd had was that they're having monthly multidisciplinary team meetings to ensure that all of the providers were consistently asking the same question. I'm not sure what PISQ stands for, and that they're pregnancy intention screening question. Thank you. And then, as Leah mentioned, they're currently in the process of developing an appropriate questionnaire to be permanently embedded as part of the EMR. So that's exciting. All right, so I'm going to open it up. And just so we have air traffic control, I'm wondering if we'll start, let's start with California. If anyone else from California has something they wanted to share about a success, any kind of an effective tool that you've used, anything that you might want to share from your site perspective. Anyone? I see that Diana's on also. If you wanted to speak to anything from the state perspective that you see that's going well.
Anita, I see that you're on. Do you want to chime in?
Please do. She's typing. Oh, she's having microphone issues.
Yeah, I struggled with the same when, thank you, Catherine, for stepping in. I thought I was audible, but I was not.
Thanks, Martha.
So I think maybe I'll chime in for Dr. Hadley, and they have successfully added a screening question to their electronic medical record. So they were transitioning to a new system and have included that. as well as in the history-taking section on medication control as part of the questions. So I think that has been a success for them.
That's great. Thank you. For those of us that work in care, we know that getting something on an electronic medical record is really, really hard to do, and it requires significant effort. So that's great to really lift that up. Let's see, is anyone from North Carolina, one of our sites, any of the sites want to share something that's been exciting or a success for you?
Hi, this is Julie from MAHEC.
Hi. Yes.
So in Atlanta, we shared the video that we were going to use to kind of spread the word a little bit more about the tool that we created through human-centered design and letting people know a little bit more about how to use that tool. So we went a little further since then, and we decided that we're going to use this once we spread it and we send it out on our learning management system, that we're going to use this to evaluate the tools so far. So we came up with some questions for different groups, so our providers, and then our second group is our clinical support staff, and then our clinical leadership. And we sent each of those groups, everybody in each of those groups, the video with a set of questions to evaluate, had they seen this process before, had they seen the tools before, had they used them like they are used in the video. And so we are, that was supposed to have been watched and questions answered by last Friday. And I haven't had a chance to look at the results, but should be getting that in. So
that's great.
That's what MAHEC's been doing.
That's great. Thank you. Thanks. Anyone else from North Carolina? I see Anita.
Okay, I think I'm working.
Yes, you are.
Am I echoing though?
We can hear you.
Okay, great.
No, you're fine.
Oh, good. I'm getting my own echo, I guess. So I think as everyone had said, the Unicare, we have had one of, I think, my biggest wins has we were converting our EMR. We were able to get a pregnancy intention question, or at least like an area and where you could see it. So if you're doing an HPI, there's a pregnancy intention question on the left side. That was huge. However, while getting that was switching over our EMR system. And so that's really been our biggest holdup because their transition was hard. So where we are now is we've done one PDSA cycle, and that was really looking at what it would be like on the patient side from asking. And one of the things we got from that is that it seems people were a little bit taken aback when it was the MA that was asking during rooming, and a little bit more open when it was the provider asking in the room. So that was kind of our where we are now, which is now to do an extended PDSA using the provider once a patient's in the room, and the question being try to navigate them through one of three things. So one is either, yes, I'm trying to get pregnant, and then doing the preconception kind of encounter. No is definitely not. So making sure that the contraception visit has already happened or they're on something or up to date, and if they want an appointment, to get the appointment. And then the middle is kind of the unsure part, which is a kind of a little bit of another referral. But the goal being that the question being asked during a visit, even if it's for a cold, but direction into what you can do to discuss this topic next.
Oh, great. Thank you. That's a really, and other folks, feel free to chat in questions if you want to ask each other more questions, or just say it since you can you have the power to unmute yourself. If anyone has any questions for Anita, let's chime in. So I guess I have one question for the not sure, which is definitely a tricky part of that question. So you're kind of working with them for to come back for follow-up. Can you say a little bit more about what you're doing for the not sure answers?
Yeah, so I think that's where I guess our biggest problem was, and my thought is that would require a little bit more training, because I think that's on the provider side where what to say after that became a little bit of a hindrance. So we're kind of trying to work on how we can do the training, and then the question being training for everybody in case the question comes out with the MAUs, but really trying to have the provider knowing what the response is, and on all three answers, a little bit more of a what to do once the patient responds, and also troubleshoot. So if the patient is taken aback, how to navigate that into a conversation rather than shut the conversation down.
Great. That sounds really interesting. And also, potentially even is asking patients, what kind of response would be helpful to them might be interesting as well. That's great. Thank you for sharing that. Really appreciate it. Let's see, anyone else from California or North Carolina? Share what's happening?
So, Maureen from North Carolina. I see that. We heard from Mayhack, and I don't see anyone from Robertson on the list. But Glenda, if you don't mind me putting you on the spot, do you want to just talk briefly about what you're doing in Forsyth? Any recent successes?
You may still be on mute. Glenda?
Sorry, I see her name, but I don't hear from her
Right.
right now.
But we can always come back.
Let's do that.
Let's do that. And if she's not available, you can fill us in. I'm gonna pitch to Michelle, who has a comment around the unsure remark. So Michelle, feel free to have the floor.
Yeah, thank you. This is Michelle Stranger-Hunter, and I had created One Key Question. And so we've been doing a lot of training around the country about allowing the ambivalence and protocols around provider responses. So I just wanted to put that out as a potential resource. And the second thing that I wanted to mention, when you talk about, let's say, patients or clients' reactions to being asked the question, in your setting, think about, would it help if you had a preface? If you added a paragraph, if it's something written, or you have a preface that your MA verbally says, found that to really shift people's response or comfort level when they're not comfortable being asked the question. That's all. Thank you.
Yeah, I think that's
Thanks, Michelle.
when we had our conversation, that's kind of where we got the most feedback and the idea of really actual training. And then when we had talked on the phone with Michelle, our two things were, number one, we have a very large Spanish-speaking patient, and having a bit more of an understanding of the cultural responses, because we found in that PDSA they were different. And culture, we thought, culture and language might have had an effect on that. And then the second part in terms of our strategy is then to make sure that we include the patient session to really ask about patients, what they feel like. But I think that we need the training before we can go to the patient session.
Great, thanks. And what we can do is, Michelle, we can reach to you and maybe include some additional resources in our next newsletter on the unsure issue in case other people are interested, and if you have sample statements or other resources. So we can loop back to you.
Okay. Sure.
Awesome. Thanks. Thank you. Anyone else from North Carolina has successes to share? I'm not sure if Glenda's available. Let's come back in case she is, and if not, I'll pitch back to you. So how about Oklahoma? Anyone want to share any successes from Oklahoma?
This is Kanisha from the Official Oklahoma Healthy Start Project. Some of the successes that we had early on when we started talking as a state and implementing our tool, I sat down with our data manager and intake coordinator. We kind of strategized how we actually would use the tool to be able to start the conversation with some of the new clients that came into Healthy Start interconceptionally and preconceptionally about their reproductive plan. So something that we focused on in Healthy Start anyway, so it was just like an added tool. So the successes that we actually had when we integrated through the intake process as when we were getting new clients, we identified early on using the tool that there were other indicators that the woman would have if it was interconceptional between children, that she may have identified she wanted to be pregnant, or she may have identified that she didn't. But then when we start getting down to if she on any birth control or anything like that, it became very evident that our case managers had some areas to focus on when they first met with them. And then also, too, it helped us identify some of their concerns about possible comorbidities. And so what she did, she did the tool, and then when she assigned them to the case manager, she gave them a copy of the tool and said, here are the hot spots that these clients really want to talk about. So it kind of gave our case managers an insight of, okay, I know a little bit about the new client, and I see the areas that we need to hit on first that's most important to them. And so it was easy to navigate their visits. So that's been a huge success that we have seen, that the case managers even view it as a helpful tool to take a quick snapshot of who are they getting as a new client.
Oh, that's great. It's nice to hear your voice. Thank you for sharing that. That's really, that's exciting. Really great.
This is Catherine, and I just had a follow-up question, Kanisha, if you had a second. When you were talking about the report that is generated, is that something that y'all have automated in the system, or is manually done? Could you describe that a little bit?
Sure. So the tool that we actually do have, she still does it by hand, that was provided to us by our state. So we do have a copy of the tool, so she uses that. When she, in our database, it's something that we use for intensive case management. When she gives them a copy of who their new client's going to be, she also gives them a copy of that hard tool that we have. We do not have the tool integrated into our electronic records. So she gives them a copy of that, so they have that, but then also, too, we're able to scan that on the client record to have it in our system.
Great. Thank you so much.
Who else from Oklahoma has something they might like to share?
This is Pam from Little Dixie Healthy Start. Of course, when we first started, we started working with Dr. Taylor. And so the very first screening tool, or the one key questions we done in her OB office, through that we discovered that really wasn't the place for this. So Dr. Taylor has then, with this next round, she's went looking for where she felt like this would best benefit. So through that, she went to the ER and she talked to the board and was talking to them about how many and came straight to the ER for pregnancy test. She felt like the number was pretty high, and the board, they didn't feel the same. So through the 3-month period, we have screened that, and in that 3-month time, 528 women went to the ER, and out of those 528 women, 48% of those went in for only a pregnancy test. So wow. That number's huge. And so we feel like, our work needs to really kind of focus there. And so that's what we're really going to be focusing on in the next, for the next testing. So then she went on and she took the one key question slides, and she presented that to the residents last week. And so the residents really liked that, and so she's going to continue with that. And we feel like if we train the residents early on and they go and start their practice and they're already doing it, then it's not going to be hard to change. So that's where we're really working right now, and that's a success.
Wow, that's really stunning information. That 48% were going to the emergency room just for a pregnancy test. Wow. I wonder how many other emergency, if you were looking across the country, how many other cases that was as well. That's really, that's great. That's really exciting.
We're also
I'm really looking forward.
This is probably covering the next question, but we're going to try to work with that emergency room to see if they won't possibly start giving just the depot Preventive shot and then just one, and then be able to refer them on.
Awesome. Thank you. That's great. Who else from Oklahoma has a success to share? All right. Let's see, who didn't I call on? Delaware. Anyone from Delaware? Anyone else? We already had one success slide from Delaware.
This is Aileen. Hi.
Hi.
Okay.
Yes.
So my success for our program is that we got a test cycle started. We ran into some challenges. Our director of women's health left, so things got delayed, and we just started keeping it really, really, really simple. So we really focused on, are we just asking the question, has it become just another checkbox? Because as part of the Healthy Woman, Healthy Baby program, we have been asking this question of anyone that's a participant in that program, but we wanted to make sure that it hasn't just become a checkbox. So we have a provider communication tool that the MAs are asking and documenting the question as they usually do, because we didn't want to change their workflow. But then there's a sheet in the room that's laminated that they just check off. And we gave a couple of options. We don't have the unsure option right now, but providers have the option of discussing further the pregnancy intention. So we have on our checkbox, it's yes, I do want to be pregnant. No, I do not want to be pregnant and I'm on birth control, or no, I'm not on birth control, and no, I don't want to be pregnant. And so all the MAs are doing is marking that off for the providers to then have further discussion with the patient while they're in the room. And they stay in the rooms, and it's been pretty successful. And we have had several patients that we have been able to get started on contraception. We work on same-day access, so most of the time we're able to put in any LARCs or provide depot or pills or whatever it is that day. So we're just really excited that we were able to get a test cycle in and have things going for the next couple weeks. We just started like the middle of May, so it took a lot of planning.
But you did it. That's exciting. That's great.
So we're working on developing further test cycles now. So very exciting.
Oh, that's great. Yeah, and you all may really enjoy Dr. Barrera's presentation. That might be really interesting if you haven't listened to it, because then you can share the link more broadly if you were interested with others if they wanted to hear it too. So it sounds like that's right on target with kind of where your project is aiming. So that's really exciting. Yes, and yay that getting started is it's important and it's not easy. Let's see, we heard from anyone else. I don't know about Glenda being on, but I would love to hear about Forsyth County if you wouldn't mind to share CoIIN on her behalf.
Yeah, I'm not quite sure what more I can share, other than what I kind of said in introduction, that they pretty much pulled together two groups that they were trying to work with, and one was not that interested in being a player, but they are now a player, from what I understand. So there are two groups, and they're working with the community care managers, and now have pulled together, I think, 3 different groups, like community folks, as well as the care managers, as well as some other providers, to come together as a co-design group after working with a human-centered design expert, to pull together the group to kind of design the actual tool that they'll be able to use. And they actually are going a different route in that they're going to kind of empower the women to kind of ask for these services or ask for this information instead of necessarily the other way around. Does that make sense?
Yeah, that'll be really, that's definitely a different approach. So it'll be exciting to have them share that at our next, when we all get together again. I think it's also interesting for us to learn how they were able to flip someone's interest in this, so we'll have to call them and see if we can hear what maybe was the magic in making that flip.
Right, what made it happen. And we'll meet, our 3 projects are planning to meet face-to-face, which we all look forward to. We did it last year, and it was really nice instead of just a monthly conference call to hear from one another. So hopefully we'll get better, more updates from each of the projects to share in a future call.
That's great. Thank you. Awesome. So any other things that people would want to share with each other? I do have a question. So, and this kind of gets us into future thinking. But, we've talked about kind of the screening, but I'm also curious to hear in terms of, are there any really wonderful resources that you all have that you like to share with your clients? You can always chat those if you don't want to say it. But kind of thinking about when she does say, I want help with this or I want that, I'm curious what different people use. So when we get back to the chat option, we can do that. You can go ahead and chat that. But put the poll back up. I think we can just maybe have it not have the whole screen. Is that possible? So our next chat is, what topics do you most want to discuss about future activities? So pick 2. I mean, we're going to talk about them anyways, but we're just curious what you guys are mostly interested in. So strategies around engagement with either clients, patients, or surrounding community, supports around thinking about sustainability, patient education and general resources, how to engage stakeholders in improving preventive care. Do you want to talk about kind of resources you want to be able to provide your team, others? Good, thank you. We've got some. Good. See, we practice the polls. There we go. Okay, all right. I'm just curious just to see where we are around. So looking at interest and engagement is important. Great. Okay. I see a lot of interest in how to engage stakeholders in preventive care. Okay. Thank you. So moving on to our next prompt. Thank you. We are trying multimedia. The only thing we don't have is music playing. Okay. So, future. These are some of the prompts that we had sent out. Do you have some strategies that you want to try? Is there something that isn't working and you want to understand more about why it's not working? Are there any supports or resources that you're really excited that you have? Maybe you have a great patient education material or website, or there's a community group that you think are amazing. Are there any gaps that you would like to see filled? And are there any measures that you'd like to explore? So there's a whole bunch of questions there. So I thought I'd open it back up, and I'm going to go back to California to see if anyone from California has any future thoughts. I know you have your big meeting coming up, and are going to get a lot accomplished in that meeting. But aside from the meeting, and I know we also have Diana on from the state, are there some other kind of bigger directions you're thinking around kind of this work in California, or kind of additional resources or things you wanted to develop. Anyone? I think Diana's still on.
I think this
Marta?
is Anita. Sorry, from Unicare.
There you go. I hear you.
Go ahead, Anita.
Sorry. So one thing that, in terms of the new measures, that is kind of in the, I feel like we're a little far away from that, but really also how do we collect the whys? So why are of the people who are unsure? So what is it that is kind of preventing you from having a yes or no, kind of a firmer plan? And looking more, because I expect that has a lot to do with social determinants of health and how we can be collecting that data in an effective, not subjective manner.
That's great. And for some people, not having a plan is a plan, too. So I think that's good to start to really dig into kind of what all the implications of that means. So I think that sounds great. Like I said, you might find some good stuff from Sonia's presentation to help guide some of those conversations. That's great. Other future directions from California or hopes?
Thanks for chatting in, Diana, about the contraception apps that were recently developed by UCSF that we could look at to promote and use as a resource as well. And then I think, Anita, a little bit when you were talking about your successes, you're also lifting up wanting an even deeper dive. I know Michelle mentioned some of those onshore materials, but also some materials that are appropriate for other populations and in different languages. So I think that's something else I've heard you lift up as well.
Yeah. Exciting. Yeah, so as we kind of are moving into this phase of the project, this is a great time for us all to kind of start dreaming about some other work we'd want to do. So that's great. And thank you, Diana, for sharing that information. And let's see, how about anyone else from California? See, how about Delaware? Kind of as you're thinking future forward, next 6 months, anything, any pain points, anything that's really exciting?
This is Leah. I think from our perspective, we're really trying to get formal contract agreements in place with not just these 2 providers that we're working with, but many more, so up to almost 7 if it all comes through. And so we're going to be hopeful that we can replicate any of the small change if there's any successes going forward, the future hope and plan. Another thing that I wanted to address is the strategy that we're going to be exploring further is the use of community health workers in this model. And while it may not align with this CoIIN work, we will be doing small tests of change because we're kind of using the PDSA and that learning collaborative and QI as a big component to our new Healthy Women, Healthy Babies program. So we'll be continuing what's happening here through that and just kind of figuring out what the use of those community health workers would be to get women to appointments, get them engaged in coming back for care, helping with messaging and education around the importance and value of well women care, and then other messages that are just the pillar of just what's facing them, barriers to access, etc.
That sounds really exciting. And nice and well in alignment with that cascade that we talked about at the beginning. That's great. Thank you. Anyone from Oklahoma want to talk about your future forward ideas? We actually have a slide because they sent one. There we go. I don't know. Jill, if you want to mention this one?
Okay, so like I think our people that talk, like when Pam was talking especially, she highlighted a gap that they had identified in the emergency room, how we could access clients that needed information. And we also realized through our first two pilot tests that we were missing some key elements of our population in some of our sites. And so we didn't make it for the last pilot, but we're going to translate our tool now, Spanish, Burmese, and Marshallese, to be able to reach all or majority of the clients that we're seeing in our 7 pilot sites. So I was trying to be creative and find how you say preconception of other languages, and so that's Spanish and Burmese and Marshallese. I could not find a free translator, so it's not up on the But so we're going to translate that and run one more pilot test in other languages as we start working on the educational materials to back up our tool with. And then at our call next week, we're going to talk about identifying a date for another face-to-face meeting that we can all get together, because I think that
that's great.
moves forward a lot faster and easier when we have an opportunity to meet face-to-face.
Yeah, there's no substitute for being able to be with proximal and with each other. Our team loved this slide. And, we all know that the word preconception is always challenging, and I thought that maybe Oklahoma solved the problem. We just use it in another language. And so there we go. We solved all the trouble with the word preconception. Because, that word looks more holistic. That's really great, and it's really exciting that you're able to do that. We know there's a demand nationally to have this in different languages, and so it's really exciting that you're able to be able to do that with this work. So thank you. Anyone else from Oklahoma have anything that they wanted to share that's going well that they're excited about?
This is Kamisha again with Oklahoma City Healthy Start. I'm glad to hear that we are really looking forward and excited of expanding the tool into other languages, because also with our clientele, we started to see a shift in the service area that we have. So we had to hire 2 new bilingual case managers, and so I know with this tool we'll be able to capture another demographic that we had not been able to previously before. So a lot of our tools we're looking at getting them updated so we can meet the needs of the community that we serve.
Exciting. Awesome.
This is Pam again with Little Dixie. In moving forward, earlier I talked about the emergency rooms, and that we're going to try to get the doctors and the nurses to do the Depo-Provera shot if they come in and don't have a positive pregnancy test, in order to get them to the doctor. And then we're going to continue trying to train the resident staff so that they can carry out our work from the ground up. We're going to start collecting that data from the emergency room as well. One of the other things that we're going to try to start working on is we're going to try to pull in Choctaw Nation and start working with them. We tried to go to the pregnancy care centers. However, we didn't get very far with that due to the family planning part of it. As far as on postpartum, we're really going to try to get postpartum visits and the baby well-child check done at the same schedule at the same time. We think maybe that if they schedule them on the same day, then maybe we can get those postpartum visits completed better.
Oh, great. That's great strategy. Thank you. Lots going on. Anyone else from Oklahoma have something they want to share?
Hey, this is Stephanie with the CSC Healthy Start.
Hi.
We're excited to do whenever we do the next pilot, just because our program's kind of changed a little bit by adding more community workers, community health navigators that will help with intake. And so I can see this tool being really beneficial for them as just another way to gauge some immediate resources and referrals as they enroll clients out in the community and not just in the clinics like we've primarily been doing.
That's great. Yeah, I want to lift up, because Oklahoma, you've been doing several rounds of pilot testing with the same tool. And I think that, there's really very little evidence or very little published or shared about that kind of process and response. So I think that you all have really amassed a treasure of information that maybe we can work with you to think about how we might be able to write that up and share. And I think others of you also, what would be really cool is to kind of look at what your results were in Oklahoma and then look at what others have done in terms of that human-centered design around a screening tool, and then maybe together we could pool our findings and maybe try to get something like that published, just because I think there's such a need for other people to understand this process from the patient's perspective. So that's me kind of both a success and a future that has kind of come into me in listening to all of you speak today. Any other success or future thoughts, ideas, pain points from Oklahoma? We're also glad they're all fine. Our last call with them, they were under a tornado watch, so exciting life in Oklahoma. So that's good. Okay, how about, who did I miss? North Carolina, future forward, exciting pain points.
So, I can talk a little bit about what's on our agenda item for our face-to-face meeting. And we're pulling in the human design expert once again because she was really helpful in the past, kind of to review the current status of each of the projects and provide suggestions for next steps, and then also to help with applying human-centered design to the implementation strategies. So we're looking forward to that. We also talked about sharing a bunch of the current education materials that we have now and the resources that each project is using. We're going to kind of bring them all to the table and review and see what each other is using and possibly identify any gaps. Maybe there's we talked too about maybe developing a piece. I think you mentioned that the National Preconception Health piece needs to be updated. I don't know that we would tackle anything like that, but we can identify what some of those gaps are, what things might be useful, what other resources we can use in our projects. And then as far as data collection and evaluation, we're going to look at those measures and try to identify what's useful in each of the settings, and also not just document outcomes, but kind of take a look at documenting the process as well. And I think that's pretty much it. Usually we get together, we do project updates, but on this particular call, we are going to talk about challenges and see if we can kind of work with one another about some of the challenges that we're facing. So those are our next steps, at least in the immediate. Unless Mahek or Glenda from Forsyth have anything to add, please feel free to do so.
I think that summed it up for Mahek.
Great. Thank you. And I think we will kind of touch back to that patient education piece in a minute for future thinking. Let's see, California or Delaware, I'll open it up. Anything else, anything you'd like to share about your kind of future forward thinking? I think I got it. I've been trying to check off, so I'm not forgetting a state. Let's see, I think we had, I can read this if you want, Leah, but this also came in from Christiana. They sent a few more slides. So they highlighted from their perspective that the work that is being done with the CoIIN, kind of as Leah had mentioned, is going to be actively utilized in this new Healthy Women, Healthy Babies 2.0, which is exciting to really be fully focusing on the healthy woman part of this equation. And as I think Leah had mentioned, when systems undergo these big transformations, that can make it really challenging with data and electronic medical records. And as we've talked about, and I know Mary Webster is on. I want to give a shout out to Mary Webster. Is our with Aptive Associates and provides all of us technical assistance. So welcome, Mary. And we know that the cycles in collecting this data is important, but also the human-centered design work, the focus groups. I mean, there's lots of different ways that we're getting data. And so I know that sometimes this bigger metadata can be frustrating, but there's also, many of you have found, like with your chat and choose in Delaware, and have found other ways to also be kind of getting data. So I really lift up all of the creativity that's out there. And then I think this is also real when we want to share our results in year 3, that, you know, making changes to these electronic medical records, it is really challenging. Anything I missed? So thinking about supporting your work, so a couple of things. So first of all, getting you money to do your work. So we've had some much smoother contracts this go around than last time, except for, I'm so sorry, Joyce and Jill, every time our contracts are so large that they kind of get stuck and lost. So we're working on that. But I think that we're doing better, and I think in terms of getting everyone resources year 2, I don't know if it's great for everyone, but it's definitely not quite as challenging as it was last year. So I don't know if people want to chat any questions, or but I just wanted to kind of lift up that that's been a really important focus for us in providing you with support. We have a new poll that's up that keeps moving around the screen to make sure you're awake. So we were interested, for the newsletters that we have been putting out there, which was the most helpful newsletter topic. So there's a lot up there. And I'm going to let you know there's an option on here that says never received the newsletter, sign me up. I confess I never had time to look. We cannot identify your response with your name, so it's anonymous. Some of the other ones, the most recent one was work from Utah. That if you haven't read it, Suzanne has been working closely with folks out in Utah, and they have been doing a lot of focus group work and exploration with women to really hear from women's perspective what they think a preventive visit is. So that is pretty new in your inboxes. It looks like the screening tools was helpful, and lifting up the resources and strategies for engagement with Black Maternal Health Week, it looks like those were useful as well. And thank you for the honesty that someone never got it. So we'll make sure to have everyone who's on this registered for this call, we'll make sure that we get you that link. Great, thank you. Do we have another poll? Okay, so looking at kind of thinking forward, as we saw in a poll earlier on this call and what we've heard from some of you, having a resource to be able to give women as a companion to a screening tool, or just in general about women's health, is important. And the Centers for Disease Control and Prevention out of Birth Defects used to have a brochure and a booklet called Show Your Love. And they have taken that down. They're supposed to be reviewing it. It's required every 5-year review, but I'm not really sure it's going to be going back up. They do have some written information on their website. And so we've identified as a team that this could be something that we could also provide some support on as a backbone. Would be to see if we can do some work to come back up with some patient-centered educational materials and resources that you all might find useful. So our first focus right now is on our website. So we don't have a poll for how many of you have visited the website, but hopefully you have. And so we're continuing to want to build resources. And so we first and foremost would really welcome your feedback about what other information you would want on this. So for the California meeting, the North Carolina meeting, and sounds like Oklahoma meeting, if you might be willing to take a few minutes on your agenda or ask people to click around the website and offer us suggestions to do some of our own human-centered design, we would appreciate that. And we want to particularly draw your attention to the section that says wellness resources. And this is a snapshot of some of these. Essentially, you click on one, it flips around with some key information, and then there's some additional resources. These pictures, many of them were sent to us by our ambassadors who wanted, actual real people, not models, on the website. And so we are wanting to continue to strengthen and build this section. So if you don't have a big clinic website or a state website and you would want to use the showyourlovetoday.com as a resource, that it would be something that you liked and that had good and complete information on it. So just wanted to let you know that we would love your help with that. And I think that Suzanne may send out an email just to see if any of you might want to actually get on a short hour or 30-minute kind of online meeting with her to actually sit together and give her some direct feedback on this resource. So that's something that we're working on. And then we thought that once we can get this information in a way that you like it, we could then try to turn this into a couple of different items. And so I think we have another poll, right, Suzanne? I may be out of order. Because we were curious to know. Here we go. Thank you. Awesome team. So we would love to hear your response on this one. So what type of patient education material would you most likely use? So the option, and this is just helpful for us for our planning, if you'd be interested in, just an actual printed brochure, flyer, something that you could put in someone's hand directly, something that could print off of your electronic health record. Is having a strong online resource available, good texting. We know that California has a really great texting model that we could potentially share, posters, and then content to support your social media platforms. So those are some different options. And then this one I think you can check all that you're interested in, so you can vote more than once. And please, everyone unmute. We would love to get a little bit more of your thoughts. We've also hearing that clearly if we have the resources, putting this at least in Spanish sounds like it would be really important. Does anyone want to just open up and offer some comments or thoughts or suggestions just on this particular topic of patient education?
I'd also like to know because there's a bunch clicking texting, resource, and digital tool. Which one? So a texting resource, meaning a text that comes straight to consumers versus a digital tool. I'm assuming, were you thinking app or were you thinking an online resource? What, kind of exploring more what that might be, since we did get a lot of response towards that one.
Oh, only one option can be selected on the poll. Thank you, Shelby. All right, so I guess you've selected your top resource. So it sounds like if there's more than one, please feel free to chat it or just give us some feedback. Oklahoma, do you have any thoughts about patient education materials or how we could be supportive?
We right now are using a lot of flyer brochures or printouts because we all don't have the same electronic health record, although, would be great if we did. But since we don't. Also, texting is huge in our state, and that's kind of a newer resource. So I think we'd like to see more in relation to the texting resource and digital tool.
Okay.
App thing, I think that might be helpful.
Okay. Maybe, Diana, we can maybe work with you all, and we could do a short 30-minute webinar and kind of demo the tool that you all have developed. That would be great. Other thoughts? Thank you, Oklahoma. Anyone, North Carolina? Any thoughts on other resources that you think would be helpful? You all are already taking the lead on this work, so maybe we could ask other sites if you have materials that you're using. Maybe we could give you an address or an email and have those go to Suzanne so that maybe the North Carolina team could look at all of them together. That might be really nice if people have something they could share. Christy said she wants information for the social media platforms, something smaller to print, like a bookmark size or postcards with links. That's great. And then there's the link to the texting campaign. Anyone California or Delaware? Any thoughts on this topic?
We keep on hearing, this is Leah from Delaware, we keep hearing so much about apps. So are they is there any research that women or patients would use them, or in my mind, I just don't want to develop something and put resources and energy into something that won't be utilized. And I know that the visits are quick and you're trying to maximize the time with the patient, and I want it to become a tool to open up discussion, not just to send them on their way and then they don't use it. So anyway, just thoughts. I didn't know if people have developed any.
Yeah, I see Rachel Berkowitz typing. I'm guessing it's going to say, how might we? Yes, I knew it. That would be, yeah, that could be something really interesting if maybe one of the sites wanted to partner with us and we could do a little design sprint on that. Maybe we could do that in North Carolina since we're here and you're already thinking about it. But I think that's a great idea to kind of put that problem out to a group of young women and ask kind of what they might want to use. I don't know that we have answered that question in this country. There's a little bit on educational material, but really, y'all, we are definitely innovation in this work because there's just been so little investment in the work that you all are doing collectively. It's so important. So thank you for that idea. If any of y'all sites that are on might be interested in partnering with us and Rachel to think about that. Or I love that idea, linking to a Fitbit. That's a cool idea.
Oh, that is a cool
idea.
idea.
That is a cool idea. All right, so I'm feeling like we may want to have another time for us to get together and think about it. I see that Susan's also typing, and I know Delaware's got a nice reproductive life plan, but she loves the exploration of this idea. I think, y'all, if we could kind of join forces on this one, it would help our projects, but it would be a big contribution to the Title V groups, I think, across the country, because currently there is no national resource on this. So we could, that's a good point, Rachel. Yeah, go ahead.
No, Sarah, this is Corinne. Aren't there 2 preconception health apps out there now floating around? I'm just wondering if there's been any testing of those or evaluation of those.
Yeah, I think we could share that the CDC had invested in a beginner app that's largely for people planning a pregnancy. Suzanne, is that still
I don't know that
alive?
I know they were planning a version 2. I don't know that it actually, the next version came out, and I'll be honest, there's a lot of the same stuff that's on the Show Your Love Today website. It's just not packaged as pretty. So, and the Show Your Love Today website is mobile friendly, so I would recommend that you just send someone to showyourlovetoday.com because it is more mobile friendly anyways. But the app was meant to, you could save information, you could track your goals. I think the version 2 was going to sync with Apple Health so that it would automatically take your steps, and if you're signed into MyFitnessPal, it would automatically sync into the app, which is a great idea because I'm not a fan of creating an app just to have an app. Because then people download it and delete it or don't use it. So I do think it's, really interesting to explore. I know that Lisa Caligari's group was also creating a preconception health app. I think it was a little bit more tied to contraception. And then Healthy Teen Network also has a digital tool.
So it sounds like there's interest in us as a backbone team looking for some published literature on this topic, pulling together existing resources. So like we did with the preconception screening tools, perhaps we could do kind of preconception educational tools, but also if any of you have other sources that, maybe it's not sort of women's health, but it's a really great something on a healthy weight or birth control or something, we could maybe look at all that's available. And maybe we could jump on a call together and we could report back and show some of those things, and you could help us think about how we might want to take this to the next step. So I think that's exciting. And it's really great energy on this. This is awesome. Cool. And I think also hearing that we need to think about this being in Spanish. I've definitely heard that. So technical assistance. So we wanted to open it up. This is a shot of the backbone team and some of our consultants. And I want to just lift up that I know Jackie Murphy's on. Been listening in today. Jackie, that's awesome. And I see that Milt has been on. Rachel and want to also do a shout out to Vanessa Lee, who is our project director and a new mom. So excited to have her back. And then also Dan is on, and he has a couple of hats that he wears with the project. So just wanted to, I may have missed someone, so I just wanted to lift up those folks. Jackie, not to put you on the spot, and you may be listening, I am curious, kind of going back to the educational piece, if you had any thoughts on that, or if there's anything that you've heard from the different clinics that you might want to reflect back. And you're mute, and I may have put you on the spot. Oh, she's typing. Okay, we'll let her type. As you see on the slide, there's a couple of webinars coming up from our data contractors. I think the August-September one that's definitely a topic I know that you all have expressed an interest in, is around health equity. And then there's one around addressing project fatigue. But I'd like to open it up. Anything else? We heard that you want some more information in unpacking the unsure response, so we can do that. Heard that you're interested in more on engagement. Anything we're missing that we could be working on your behalf? Thanks, Jackie. Jackie typed that y'all are doing a great job and she's available for questions, and that it sounds like everyone is on track. Thank you. Anything else that's coming to mind that you all need? Nothing. So I wanted to let you know about kind of one paper that is going to be coming out at some point. And I think it's going to be really interesting for us in thinking about our work. So I had a chance to go to kind of a think tank group that took place in California that was convened by the Prematurity Initiative there. And it included folks like Lisa Caligari and Sonia Barrero, who you've mentioned a few times. And there are a lot of reproductive justice advocates there, someone from CDC and HRSA, and it was a big conversation about, like, the goal was to kind of redefine the word preconception and unpack the word preconception. And it was a very interesting conversation. And I think that they are working on a paper with kind of like a response to the word preconception, and with some suggestions about how we can kind of build and kind of layer on that word with some different lenses. And so, one thing that's coming out of that is that, talking about women's health and women's health equity, maybe one great way to be framing some of the work that we're doing. And you may have noticed that in some of the things that we're doing, we're also kind of broadening the frame to women's health and women's health equity. And as soon as I have an opportunity to share that with all of you, I'd be happy to do that. But would love to have that conversation with you all at some point in the future as well, just because we know that the word preconception is always a really interesting space to be working in. And so just curious if any of you have found any ways in terms of talking about preconception with this project that you felt to be particularly effective, that you might want to share with us as we close out. Looks like we're going to give you all about 30 minutes back to your day, but I was just curious overall, being that we're the preconception CoIIN, if there's any kind of thoughts or feedback you would want to share.
Sarah, this is Jill. I just have to agree with you that I don't have any great insights, but I think we can definitely support the fact that preconception is not the word to engage our clients with. And even if you just say we want to talk about you being as healthy as you can possibly be. They have already heard about stuff like in the health department, so the immunization clinic might have talked about immunizations, and the clinic might have talked about, and they get smoking cessation everywhere. So it's interesting. I think we still need to work on how to frame preconception health in a way that really engages them. Our tool is colorful, and the questions are short, and we've tried to make it as streamlined as possible, but I don't think we've still hit on what would be the perfect terminology to engage more people in choosing to think about preconception or interconception health.
Right. And this is Joyce. I mean, I would agree with Jill that if even just talking in public forums, I think most people do not use the terms preconception and interconception. And when we use those, we do get looked sometimes like we're speaking a foreign language until we go into what it is, and then they're going, well, it's easier just to say, being healthy before pregnancy, between pregnancies, and then addressing that way. But yes, we are open and would love to hear more in that regard about more engaging ways to address the subject and also to call the subject overall.
Mm-hmm. Great. Yeah, Shelby, go ahead.
This is Milt Cuddlechuck. So I don't have a suggestion on this particular theme, although it's really important to think how to frame this. But I do think, I just want to add in, as much as this is about women's health, the sort of absence of thinking about the same topic for men also misses a whole world of people who are involved in the health of babies before conception, and also misses a world of people who might add some additional momentum to women's health by also engaging them. And that's just it's a theme that has come up a few times in our work, like what does one key question mean for men in any of their primary care visits, which may not be many, but it's an interesting question. So I just want to encourage, as we broaden our thinking about preconception health to health before, during, and after pregnancy, to broaden it also to the number of different possible participants who might be involved in that conversation.
Thanks, Milt. And Rachel also listed up for non-binary individuals. I know that Suzanne has been working with the Show Your Love website on trying to, we kind of have a men and women's health, but that's binary. So it's really I know Suzanne's been reaching out to different communities to help us think about languaging on that. And so I think we need to continue to lean into that space. I know our screenings are really focused on women, but perhaps as we're going into starting to explore with women in terms of what helps them be healthy, that might be what supportive people around you can support health and well-being, which might be a way for us to also connect with partners. So thank you for that. I think that's really important. I hear that. So I will be definitely, so just to, spoiler alert, this 2-day meeting with the most diverse group of activists that I have ever had the privilege of being in a room with, and certainly not people afraid of expressing their opinions. It's interesting that they settled on what they would propose is the concept of women's health equity. And so that's what they came up with out of a 2-day meeting. So if we can come up with something more catchy than that, that would be great. But I think that that's kind of taking back this women's health lens, and I think that's just where they came. But as soon as I'm able to share that work with you, I'd be very excited to have us maybe have a conversation about that too. And so it sounds like you also aren't going to be upset. In case you notice, we're starting to pivot to using more women's wellness, women's health, and a little bit less preconception. So it sounds like you all are okay with us moving in that direction. So that's really good to know. Let's see. Before we hang up also, I want to just see if Vanessa has anything she might want to share with us from the HRSA MCHB world and perspective.
Hi,
not to put you on the spot, Vanessa.
Yeah. Can you hear me okay?
Yes.
Great. And thank you so much for a wonderful meeting, and it's great to connect with all of you again. I'm sorry I wasn't able to be there at your January in-person meeting. I just returned from maternity leave about 3 weeks ago, so just catching up on all things CoIIN. This was a very helpful call to just hear some of the site-level updates, so again, thank you. Not too many updates. I'm not sure if APT was going to share some of their upcoming TA and webinars, so I don't want to take that one. But I guess one sort of aligned program is that many of you are aware of. We have a bigger and growing sort of maternal health and maternal mortality and morbidity portfolio in HRSA MCHB, and so a number of funding opportunities went out, and I'm happy to put a link in the chat or follow up with Sarah and Catherine after to get that out if you guys haven't seen those. So again, we do have 3 funding opportunities that just went out around maternal mortality and morbidity, and that might be of interest to some of the states and partners. Sarah, are there other updates that you can think of that I might have missed or shared with you?
No, I think those are good. And I think that we did share, the CDC issued a report on maternal mortality that really lifted up the tremendous impact of chronic conditions on maternal mortality and morbidity. I think that kind of underscores, I think all of you have some type of screening on a chronic condition in your instruments. And so I think that also kind of deepens the impact that we're having by also thinking about how we focus on those unique individuals. And we can resend that article, put that in the newsletter again, but I thought that it would make a really strong case for the work that you're doing as well. Yes, and Mary is still on. And Mary, is there anything you'd like to say about any upcoming webinars or anything else from APT to close us out for the day?
Yes. Hey, hello, everybody. Thank you for today. This was I'll echo what Vanessa said. This was very helpful, getting a state-level evaluation, just hearing from each of you. And so a lot of exciting work. We do have a universal webinar coming up on the 11th. So believe it or not, that's next Tuesday. And that is at 3:30 Eastern Time, and we're talking about data for moving our projects along, understanding it, using it, the types of data that's out there, qualitative and quantitative, which I've heard that pop up a lot in your discussions, right, today? Using qualitative data, using your words, things you hear, your feedback that you get from your customers, and then also the quantitative data, getting information from charts and counting how many times something's done. So it's going to be interactive. We really appreciate your input into these webinars. You're the ones who make it even grander. But we look forward to seeing you, quotes and air quotes there, on Tuesday at 3:30 Eastern. And that's understanding and using data to drive improvement and share your success.
Great. Thank you, Mary, and welcome to being one of our consultants. Thank you.
Wonderful.
That sounds great. And so I think that's all we had. Just wanting to remind you where we keep a lot of our information on beforeandbeyond.org. And if you're not already with us on social media, please join us. I think kind of any announcements from our team, we do just want to let you know that our team is also expecting a baby at the end of July. That would be Suzanne, of course, on the team, but we are all very excited about having a baby on our team. So I think if you have any particular needs for support around communications or screening tools or anything, it would be awesome if you could get to Suzanne, by the middle of July. And also, if she sends you emails, you might want to answer sooner than later. So I know she's wanting to get a few things moving forward in terms of some future thinking around some of the tools. So just wanted to let you know about that going on in our team. We're really excited about that. And I think, did I miss anything else? Catherine, Erin, Suzanne?
No, this is Erin, but just thank you for all your great work in these pilot sites. This is really amazing, and y'all are making great progress. It's just really exciting to hear about.
This is Catherine, and I concur 100%. This has been really exciting, and thank you for making an hour and a half of your time available to join together remotely on a Friday, and we really appreciate all of you for the work that you do on this project, so thank you.
Yes, thank you. And hope everyone has a wonderful weekend. And stay tuned for emails from us. Have a great day. Thank you so much.
Happy weekend, everybody.
Happy weekend. Bye, everybody. Thank you. Bye. Bye. Suzanne, I think it's still recording. Catherine, Erin, Suzanne. I think it's still recording.